Welcome to the Swine Health Blackbelt podcast, the latest swine health research digested for you. My name's Dr. 𝗘𝗃𝗀𝗁, and I'm the host of the podcast. Joining me for this week's episode is Dr. Rodrigo Paiva, a graduate student at Iowa State University. Dr. Paiva, welcome to the show. Thank you very much for joining me. Please give the audience a little introduction. Tell them about yourself.
Yeah, thanks for having me, Dr. 𝗘𝗃𝗀𝗁. I'm happy to be here. I'm from Brazil, and I graduated from there as a DVM back in 2013. After that, I started to work in a food company, BRF company, as an extension veterinarian. First 2 years and a half, responsible for health and production of finisher sites. After that, I moved in the same company to work with breeding herds and nurseries, also focus on health and production. And after almost 4 years in this company, I moved to another company, to a genetic company, 𝗕𝗅𝗽𝗲𝗁𝗁 PIC in Brazil, working as a technical service, more focused on reproduction stuffs. I also had the opportunity to do an MBA in Brazil, focus on people in market management from 2018 to 2020. And then 2021, I decided to get back to the university, came to Iowa State. In the fall semester of 2021, came to work with the Field App group and to do my master's. Focus on breeding herds projects, more specifically for my master's, working with risk factors for sow mortality. The study that we're going to talk about in a bit. And defend my master's last December, and currently I'm working on my Ph.D. Now here close to the VDL with Dr. 𝗕𝗰𝗴𝗿𝗏, and focus on E. coli disease.
Excellent. You mentioned that you've got a project working on sow mortality, and there's probably those in the industry that have sow mortality fatigue. We've been talking about it for, it seems like 5-7 years now. And unfortunately, the problem doesn't have fatigue. It just keeps getting worse and worse. At least I know that's a lot of people's perspective. But you want to talk to us a little bit about, Rodrigo, about why were you interested in sow mortality, and ultimately, what do you hope to help people understand about it?
Sure. Yeah, as you mentioned, sow mortality has significantly increased in the past years, right? The benchmarking data that we have out there has shown that. And but I think it's also important to mention that we still have a huge range in sow mortality rate. For example, Dr. Jason Ross here from Iowa State, he has a study from 2019 showing that in that case, we had farms with 5-6% of sow mortality and farms with 20-25% of sow mortality, so 20% of range. And we know that a lot of factors can be associated with that, right? And those factors, they happen over time and together, so it's a multifactorial issue, right? And that's why it's important, from my understanding, to do studies like this one, that you can look for factors individually by itself, and also put in a model and look for those factors together and see the association between them, among them, and end up with those main factors that could help the producers, the veterinarians, to take decisions right out there. Having said that, we designed this study here at Iowa State to better understand the potential factors associated with this issue with sow mortality. In this case, from 2019 to 2021, weekly data, health status variables, nutritional variables, intervention variables, data from 48 breeding herds, around 220,000 sows, all located here in Iowa. A lot of data. Putting that data together here, a big credit here to this study to Dr. 𝗕𝗏𝗏𝗏𝗏 and Dr. César Moura, that for all their support putting this data together and bringing up the main risk factors, like I said, to trying to help the producers, the veterinarians, to focus their resources to improve sow mortality.
Well, Rodrigo, let's talk about those risk factors. What did you look at, and what risk factors did you find that were associated with sow mortality? You talked about your multivariate analysis. What's the learnings we can take out of that?
Yeah, that's a great question. We use our models here for total mortality, but also we did a breakdown of sow mortality with the three main causes of mortality that we have out there. In this case here, it was sudden death, followed by lameness and prolapses. First, we run the model for total death and also the same pattern of modeling for each cause to see if the factors will change between causes, right? It could help to also to take better decisions. So in this case here in this study, PRRS was a very important factor, but we also learn about single disease versus multiple diseases. In this study here, for example, those farms that broke with PRRS and they were 𝗕𝗃𝗃𝗃𝗏𝗃 positive, they had higher sow mortality. So the impact of sow mortality on sow mortality was way higher. So the same thing, the farm that we had that broke with PRRS was undergoing PRRS elimination, and they had Seneca outbreak. For example, the sow mortality was higher. So single disease versus multiple disease in a sow farm. So mycoplasma, for example, is not a disease that causes impact in the downstream performance, but we saw that also from a breeding herd standpoint, it's very important to measure it and to work on those diseases. Talking about pen gestation and stalls, so we had higher mortality rate on pen gestation comparing with stalls, especially about lameness. And when we had those Seneca outbreaks, the sow mortality related with lameness was also higher on group housing gestation versus stalls. In terms of feed medication, we learned that regardless of disease status, feed medication helped in this study. Like I said, the data was in a weekly base, was weekly data. The weeks that those farms were receiving feed medication, the sow mortality decreased. And regardless of, for example, PRRS status, which it's observational study here, we cannot make a lot of assumptions, but like I said, it's a study that it's important also to generate new hypotheses, right? And in this case, for example, negative farms, PRRS negative farms had lower mortality being medicated, which may be associated with other diseases that it's happening out there, or secondary pathogens that it's happening we did not measure. And we also had a variable here in our model, which is bump feeding. It's the increase of amount of feeding for a late gestation sow. And in this case here, we had the opportunity to compare non-bump feeding with bump feeding, and we had a higher impact in mortality for those farms in terms of lameness problems and prolapses for those farms that were not using bump feeding. It's important to mention in this case that we do not have body condition in this study, so it's an important variable that we did not collect. So it may be associated more with thin sows, I would say, because I would assume that, right? We know that fat sows, or we don't have to overfeed sows if they are in a good body condition, right? So those were the main factors that we found.
Rodrigo, you talked about concurrent disease, and specifically PRRS with mycoplasma present on the farm being more worse mortality than just PRRS alone. Do you remember how much? What was the difference a producer could target there?
It was about 4 or 5%.
Wow.
Higher mortality with farms that had mycoplasma versus not.
I think that's pretty significant information for producers that are thinking about mycoplasma elimination.
Yep.
A full value relationship starts with understanding your business, and Elanco knows growing the healthiest pig requires focus on every segment of production. Through continuous innovation, trusted solutions, and actionable insights, Elanco is invested in helping you achieve the full value of every decision. Their portfolio offers solutions that manage disease challenges, minimize variation, and mitigate mortality to optimize pig health. Get full value from start to finish with Elanco.
You talked about PRRS being bad in general, and I think we all know that, right? The only people that are happy with PRRS are the ones who don't have a wild-type PRRS virus in their farm. But did you see anything with lameness or prolapses or sudden death, those three main causes? Did you see either of those three elevate during the PRRS outbreak, or was it the other categories that elevated?
Exactly. PRRS, in this case, had a impact on all of those causes, on total mortality, and all of them. Those farms that broke with PRRS, they had worse mortality, especially in the first 16 weeks of post-outbreak.
Rodrigo, did you look at season or month as a variable in your analysis? And if so, were there months or seasons that stuck out as being better or worse for sow mortality?
Yes, we did look for season, and the fall season was associated with higher sow mortality.
Very good. Well, Rodrigo, thank you very much for coming on the show. I really appreciate the information that you brought.
Sure, appreciate the opportunity.
Yeah. Well, thanks for being on here. And to our audience, thank you very much for listening. If you haven't checked out our website at swinehealthblackbelt.com, please do so. Thank you very much for listening to the Swine Health Black Belt podcast. Subscribe to the podcast, and we look forward to having you back here again next week. For Dr. Rodrigo Paiva, I'm Dr. Clayton Johnson. Thank you very much.
Hey, everybody. We're always searching for the latest and greatest research to share each week. If you have a swine health-related research trial and would like to come on the show and talk about it, share it with us, please feel free to email the research to hello@wisenetics.com. That's HELLO@WISENETIX.com.